a fellow of the ABORM. I met Leslie many, many moons ago. I heard her lecture back in the day. We were at a live conference, and I was so appreciative of the knowledge and experience that she shared in her lecture. And then immediately we had her do some lectures on healthy seminars. And she had actually done many years ago a version of this lab testing, but that was a long time ago. And she's got more information, more comprehensive information. And we had a discussion. I was like, I'd love to hear what you're doing these days. And I know my peers would. Would you be willing to do an updated version? And that old version was 6 hours. This is 12. So it just in itself, it's a very updated version. And I know from my clinical experience that patients want that underlying cause. They're looking for answers and solutions. And they come to naturopathic physicians, functional medicine doctors, and now even acupuncturists that have this integrative approach because they want to leave no stone unturned and they really want to look at things on a cellular level. And that's what we're going to get today from Leslie. So guys, sit back, post your questions in the chat room. We'll moderate these on your behalf to Leslie. And I've experienced Leslie's teaching many times. If you're new to hearing Leslie, you are in for a treat. Leslie, please take it away.
All right, thank you, Lauren, and good morning to everyone. At least it's morning in California where I'm at. And I just want to welcome you to this weekend course. I think it's going to be a good one. I'm really happy with the way the PowerPoint came out. I've been working on it for some time now. And as Lauren said, it's an update of courses I've taught previously on healthy seminars, and I think that it's going to be a good weekend. So what we're going to be talking about this weekend is lab testing for fertility patients, and it's a comprehensive overview. It's comprehensive because we're going to go over everything from A to Z. It's an overview because there are going to be areas where you're going to want to take a deeper dive, and we're not going to be able to take all of those deep dives this weekend, but I hope that it's going to give you a really good overview of lab testing for fertility patients. So a little bit about me. I graduated pre-med back in 1984, and then I went to the American College of Traditional Chinese Medicine in San Francisco. I graduated in 93, and I opened up my private clinic in 1995. So I've been in practice for 26 years and counting now. And I've been doing women's health and fertility from the very beginning. And a lot of what this course is talking about is the information and the testing that we work with in my clinic every day. And this is what we're going to be going over. We're going to start with the standard fertility workup, and we're going to follow that with a comprehensive health panel, which is also called functional blood chemistry. And those two sections are the testing that we do on all of our patients in the clinic. And then the third section, advanced screening, is for specific issues that we test on a case-by-case basis. And just so you know a little bit more about my clinic, I have 2 colleagues that have been with me for many years, and we work together as a team. And we work primarily, we see fertility patients. That's about 95% of our practice. And these are the tests that we do and talk about day in and day out when we're working up patients, when we're doing our case reviews and setting up our treatment plans. And so the information this weekend is really what we use in the clinic all the time. So it's based very much on on the working knowledge that you want when you are a fertility specialist. Okay, so the first thing we're going to talk about is just some general ideas and timelines for testing. Now, when you're doing a fertility workup for women, the timeline that you want to do that workup is going to be age dependent. And so when you have a woman who's 30 years old, they can try to conceive for a year before you really need to think about getting a workup done. Of course, if they want to do a workup earlier, you certainly can, but you've got a little bit of time and you don't have to necessarily do a lot of testing right away. At 35, you want to give them maybe 6 months of trying to conceive before you start to do a workup. By the time they're 40, you want to get them worked up even before they've started trying to conceive. And that's because as women get older, and as particularly their eggs get older, it can be, you want to make sure that you're not overlooking any issues that are going to be making it harder for them to get pregnant, because you don't want to waste time. You want to make sure you're making the best use of their time. And at 40, you want to get that workup done right away. For men, I think it's great to get a semen analysis done at the start of trying to conceive. There's really no reason to wait. Sometimes it can take a little bit of time to have the gentleman want to go ahead and do that test, but it's really good information to have as soon as you can get it. The comprehensive health panel, and we'll talk more in a few minutes about what's included there, but again, I like to do that at the start of trying to conceive because it gives us a lot of good baseline information to make sure the patient is in good health before they start trying to get pregnant, or if there are going to be some other issues we want to address, we can go ahead and start working on those. The advanced screening, you do that when indicated. And we're going to be spending a lot more time on what that advanced screening is and when you would use it. Okay, so we're going to be going over a lot of different types of testing this weekend. We'll be looking at a lot of different blood tests, and we use blood tests to evaluate hormones. It's part of the comprehensive health panel, which includes things like iron levels and vitamin D. And it's also used for a number of the advanced screening tests that we do. We measure semen and a semen analysis. And then there's also imaging. And we're going to go over the imaging in more detail, but we're talking about hysterosalpingograms or HSGs, ultrasounds, saline sonograms, hysteroscopies, laparoscopies, and MRIs. Now, I'm based in the US, and I work with one lab through two different portals. LabCorp is the lab that we send our patients to. And if they're using insurance, they go through our direct account with LabCorp. If they're paying cash because they don't have insurance coverage, we work with professional co-op services, which gives us labs at a great cash price. But those labs also get tested at LabCorp. And that's what we use for blood testing. For semen analysis, we send our patients to a local IVF clinic where they can go in as an outpatient, meaning they don't have to be a patient at the IVF clinic. They can just go there and get their semen analyses done for us. And then the imaging, we are typically having our patients either work with their OB-GYNs or they're working at the IVF clinics. Now, I just want to talk a little bit about language and gender identity. In this lecture, I'll be using these terms for anyone with a male reproductive system. That's what I mean when I'm talking about men and male. And when I use the terms women and female, it's to indicate someone with a female reproductive system. And that's just going to keep it really simple for the sake of this lecture. There are some other terms you can use for non-binary gender identity. One is person with eggs, another is person with a uterus, and also person with sperm. So that is our introduction. Any questions so far?
We're good.
Okay. So our first section is going to be the standard fertility workup. And what we're going to be looking at in this section is, to start with, the standard fertility workup for men, which is a semen analysis. The standard fertility workup for women includes hormones and imaging. And then we're going to also examine some of the common patterns of infertility in women, including diminished ovarian reserve, or DOR, polycystic ovarian syndrome, PCOS, and hypothyroidism. What is true in my clinic is that we are in the San Francisco Bay Area, and we work with a lot of older women. So the most common challenge we see is diminished ovarian reserve. across the country, the most common fertility challenge is polycystic ovarian syndrome. And hypothyroidism is also fairly common and often undiagnosed. So these are the three that we see the most frequently in our practice. And I want to make sure that by the time we finish this weekend, everyone is really comfortable recognizing these patterns. Now, these are some of the abbreviations that we're going to be using throughout the weekend. And the first is AFC, or antral follicle count. And that is how we're going to go into all of these in more detail as I go through the slides. So I just want you to kind of know what the abbreviations are. CD stands for cycle day. We've got DOR for diminished ovarian reserve. HSG for hysterosalpingogram, because who can say that? It's a mouthful. PCOS, again, much quicker to say than polycystic ovarian syndrome. RPL for recurrent pregnancy loss. SIS for saline infusion sonogram. TTC for trying to conceive, and US for ultrasound. Now, we already touched upon this in the short introduction. When you have a patient that's come in to see you, this is the timetable you want to be thinking about for their standard fertility workup. And again, for the men, getting a semen analysis as early as possible. And for women, it's going to be age dependent. So again, if they're 30 years old, you can start to get the workup after they've been trying to conceive for 1 year. If they're 35, you want to wait only 6 months. And if they're 40, you want to get started with the workup even before they're trying to conceive. And, you know, the thing to bear in mind with this particular slide is that the general idea is that you wait for a year of trying to conceive before you get your workup done. And you know, most of our patients that come in, depending on who they've seen so far, if they've only been going to their primary care doctor or their OB-GYN, their gynecologist, they may be 38 or 39 and their gynecologist is saying, wait a year and then we'll start testing. For us working as fertility specialists, we have a little more of a nuanced appreciation for the value of getting information as early as possible in the process and not wasting time, as it were. So you're going to sometimes get patients coming in who are, as I say, closer to 40, telling you, oh, my doctor won't run any tests until I've been trying to conceive for a year. And you're going to need to be the one to work with them to understand they want to get that testing done sooner than waiting for a year. So when you're doing a workup for women, there are certain things that have to be done on specific cycle days. And on cycle day 2 or 3, there are the hormones FSH, estradiol, and luteinizing hormone that all need to be drawn on cycle day 2 or 3. That's also when you're going to get an ultrasound done for your antral follicle count and potentially a saline sonogram. That's often done, for instance, as a baseline before somebody's starting an in vitro cycle. On cycle day 7 to 10 is when you're going to have patients do their hysterosalpingograms, when they're looking at the fallopian tubes and the interior of the uterus. And then on cycle day 21, or 7 or 8 days past ovulation, is when you would do a test for mid-luteal progesterone. And there's a number of tests that can be done anytime in the cycle. They're not dependent on what cycle day it is. And that would be AMH, TSH, prolactin, testosterone, DHEA, vitamin D, ultrasounds for uterine fibroids, and semen analyses. Now, I appreciate some of you may know what all of these are, and others of you might be wondering, huh, what is she talking about? And I can assure you we're about to get into all of this in a lot more detail. So the standard fertility workup for men